Hello, my name is Dr. Mazie Tsang. I am an assistant professor at Mayo Clinic, Arizona. I specialize in the treatment of lymphoma and chronic lymphocytic leukemia. As a clinical researcher, I focus on geriatric hematology, which is um, researching how to help older adults with cancer live as well as possible for as long as possible, and examining what we can optimize to improve their overall outcomes. And so today I have the honor of discussing the geriatric assessment with you. The geriatric assessment is a set of surveys that go across 12 domains, which I've depicted here. I will review each domain with you briefly and talk about how the geriatric assessment can be used in your care. So, according to the ASCO Care Guidelines, the American Society of Clinical Oncology, and other associations, anyone who's 65 and older with cancer should be considered for a geriatric assessment. And the geriatric assessment can be conducted in any one of these components. Sometimes you'll see a screening tool that will first be done prior to doing a full geriatric assessment. And anyone on your care team can conduct the geriatric assessment. So the first domain I would like to discuss is the functional status. This is basically assessing how physically fit you are to be able to conduct your daily activities. That includes brushing your teeth, putting on your clothes, dressing yourself, taking a bath, managing your medications, and going to the store to shop for groceries. Next, we have polypharmacy. This really assesses how many medications you're taking. Are you taking so many medications that could interact with each other and cause you to be in an overall worse state? So there are different criteria that could be examined, including the Beers criteria, which basically looks at what sort of medications could be considered high risk for older adults. Next, we consider falls and mobility. So this really assesses how much is a person able to walk and how many falls have they had in the past 12 months. Social support identifies how many people around you are able to provide a level of support to take you to your appointments or to be someone that you could talk about your feelings, your medical concerns with. Cognition assesses how much you're able to recall and execute your memory so that you could function day to day. And oftentimes, we can use different types of assessments that could give different ways of measuring cognition. And any one of these would be a perfectly fine instrument to consider. But the cognition test is basically asking you to do things like remember 5 words or count backwards by sevens from 100, draw numbers on a clock and the hour and minute hands. And so you'll be going through a series of questions that are like that to assess how much you're able to recall in the short term and the long term, and how much you're able to manipulate with different puzzles. Nutrition. So the mini nutritional assessment is really to assess how well you're eating. We also look at weight loss and consider how much weight you've lost in the past 6 months. Mood disorders assess whether people have any depression or anxiety. As people age, life circumstances change, and people may lose a lot of people who are close to them. And so it is understandable, if people have different moods that are associated with that, and that sense of loss and grief. Comorbidity, it basically assesses all the other medical conditions you could have besides your cancer. And all of these medical conditions can impact the way that you're treated and how you respond to different treatment. Fatigue assesses how tired you are and how much of your day you spend in bed or in a chair. And geriatric syndromes is very similar to what I've already identified in the past domains, but it looks at any of the other uh, conditions that commonly affect older adults. And that can include polypharmacy, that can include frequent falls. And there are other conditions that we would worry about for people who are older. And this basically identifies every other possible concern that we would identify. And so the geriatric assessment really can be applied to your decisions with your oncology team about what treatment would be best for you. So sometimes when people have, a lot of fatigue or poor functional status, some of the conversations about the treatment options would really be focused on how the cancer-directed therapy can impact and possibly worsen some of what we're already seeing. Alternatively, if the geriatric assessment identifies symptoms that could be reversible or that are really important to you as a patient, then that's something that you could have a conversation about so that we can make sure as the oncology care team that we are providing the best care possible for you that honors your goals and your values and ensures that you're getting your concerns addressed. And so, what I mean by that is for some of my patients, they would prefer to not receive a treatment that may potentially put them in a skilled nursing facility for short-term rehabilitation. They would rather have a treatment that allows them to live a better quality of life, even at the cost of living for a shorter amount of time. And so that is something that, as a patient, you are the one who's driving your care, and we are here to support you in any way. And so the geriatric assessment is a great tool for both patients and the care team to ensure that we're providing the best care possible, especially for our older adults who have a lot of different considerations that can make their care more nuanced. Thank you so much.